Many have written asking about testing. Should I get tested for COVID-19? Well, I'll begin by saying I'll give you the answer for today, but the answer changes day to day as the disease spreads and accelerates across the country. Why does it change? Because we have in America a critical shortage of tests. So we cannot test all that we really should be testing. Thus, we have to ration the tests that we have to where they can do the most good. I'm in the middle, day to day, of the logistics to increase the nationwide supply of tests, but it will be 2 or more weeks before that supply is truly adequate. Now to the answer of the question. The CDC issues general guidance for whom should get tested, but leaves the ultimate decision of testing to state and local governments based on resources available, and most importantly, ultimately to clinicians based on the very specific needs of their individual patients. Generally speaking, with shortages still present, the CDC recommends that testing be reserved for those who have the major triad of symptoms we have been seeing with this disease, that is cough and fever and difficulty breathing, and falls into one of the following categories. So symptoms and then one of the following categories. Number 1, if you in the previous 14 days before the onset of your fever, cough, and difficulty breathing had close contact with a suspected or confirmed COVID-19 patient. Second category, if you are an older adult or an individual with chronic medical conditions, the sort of conditions that weaken your immune response, like those with heart disease and diabetes, lung disease, or cancer, among others. And the third category is if you're in a hospital. And the fourth and last category, if you have traveled from an area, could be a country or a region, where there's community spread within 14 days of your symptoms onset. So, as of now, if you do not have symptoms, you do not need to be tested. And if you have symptoms, you should only be tested if you fall into one of those 4 categories that I just mentioned. Again, these are general guidelines for prioritization from the CDC, and the ultimate decision on whether a patient will need testing is made based on those state and local considerations, such as whether or not the tests are available, and to the individual doctor or nurse, their judgment based on your individual health and circumstance. The extent of testing opportunities will definitely increase as more kits become available. But for now, if you have mild to moderate symptoms that are not causing severe fever or shortness of breath, stay at home and contact your provider, initially by phone, for individualized guidance. Remember, the overwhelming majority will recover just fine after a minor illness. In addition, the CDC has created a new, easy-to-use coronavirus self-checker. It's a new feature on its website that allows you to go through your symptoms, and it will guide you on appropriate medical care. I highly recommend it. You might just take a look at it today. If you need a test, where do you go? Your local provider, as well as your county and state departments of health, will have information on testing locations. If you have a telemedicine benefit as part of your health plan, you can start there. In my home state of Tennessee, the State Department of Health maintains a list of COVID-19 assessment sites by county that is updated daily on its website. Most locations do a phone assessment first to determine if an in-person assessment or test is needed. Again, most individuals, particularly those with mild or no symptoms, do not need a test. A final note, not so much for the individual, but more for the public health community. While increasing the number of tests is fundamental to stopping the spread of this virus, we need to collect and record other essential information as these tests are administered. We can then make intelligent use of the data to end the pandemic. We need to capture the clinical conditions of those tested, how they were exposed to the virus, how they compare to people who test negative. If we do all this with increased testing that is on the way and more targeted response, we can much more quickly and safely end the sweeping, broad restrictions of sheltering in place and staying at home. Keep your questions coming to this platform, and I will do my best to get the latest, most trusted information to video like this and to my podcast, A Second Opinion with Bill Frist. Visit asecondopinionpodcast.com. That's asecondopinionpodcast.com.